So treatment at Nottinghill Family Wellness Centre for a QL or a TL injury starts usually with some IFC machines. This is electric stim. They on with suction applicators. 10-12 minutes of that loosens the back up. We usually put a heat pack on you. Most patients, the second thing we'll do is Shockwave. Shockwave is a pneumatic gun. It helps break up scar tissue and promotes a lot of blood flow. Most patients love this on their low back. So there's a bullet in the tube here that hits like that. We run it across here on the QL, the injured QL, come up to the joint and work around like that. Most patients will get this. If we do both sides, maybe 700-800 hits a side, but about 1,200 on the damaged side, working up to the joint and then down here. Certain patients will also do some ART and some muscle release, and we'll just work that whole muscle on here. We can really find the knots and really just dig into it. And all this does is prime you for the adjustment, which I'm about to show you now. Okay, for the adjustment portion of the treatment for a TL or QL injury, we usually release up in here and the low back, but our main focus is right through here in the transition between your thoracic spine and your lumbar. So the patient will just drop her hands to the side for me a second, deep breath in and out. We'll get everything moving up through here, and then a little different motion when we try to adjust the upper spine, or sorry, the lower spine here is deep breath in and out, and I kind of swing like a J motion. You can't really see it, but I'm swinging in a J pattern like that just to try to get this joint to release. The adjustment for the TL joint is a little different than a regular lumbar or SI adjustment. A lumbar and SI adjustment, I come in with the patient, drop here, I roll, and I get a little bump just right in here. Now that gets the SI joint and the lower lumbar spine to release, but what we want is a little higher up. So I have to take them, kind of get my arm in their armpit, and then I bring them down, ask them to squeeze my arm down here, and I come through and distract them to push and get that joint to gap. If it moves first visit after the Shockwave, people will notice a massive improvement even getting off the table the first time.